Hello, my name is Dr. Ruth Newstifter. Most folks call me Dr. Ruthie. I'm a professional sexuality educator here in Washington, D.C., and I'm also a relationship expert. Thanks to the folks at funwares.com, I'm here answering your questions on sex and relationships. Lately, I've been having some great conversations with folks about different areas of the vulva, because that's what I talk about with people, and different areas that people can feel a lot of pleasure, depending on their body and depending on her time of the month. So I thought that would be a great thing to bring in. It's pretty common that I meet women who tell me that they're not always consistent in what kinds of things give them pleasure when their partner is touching them or when they're touching themselves. And this is absolutely normal. As women, our bodies change throughout the month, and our bodies change when there's childbirth, when we hit menopause, when we have surgery, when we take certain prescriptions. All kinds of different things can make our bodies change, whether we're male or female, and especially for women with those monthly cycles and things like that. So let's talk about different areas, because what it is when things change around at different times is an invitation for us to better explore what it is that we like and to find new stuff that we like at different times. So that is very exciting. There's no reason to be bored or frustrated. It's just a great opportunity to explore pleasure, and who doesn't want to do that? First, let's introduce you to your vulva. This is Venus, my stunt vulva. And let's just take a brief overview of the different areas. Your vulva will most certainly be smaller and look different than this, and most likely be different colors as well. But all of the things are going to be in the same place. So you can get yourself a mirror, take a look at your partner, and follow along if you so choose. This outside the mons is the big fluffy area up here where there's lots of pubic hair. It's not on Venus, it's just above. And then we have the big lips, the labia majora here on the outside. There's oftentimes hair and fur here. And then we have the inner lips, labia minora, and they are oftentimes not symmetrical. One is a lot bigger than the other. Sometimes they're really tiny and so tucked in that you can barely see them. And sometimes they're really, really flowery and bold and all over the place, right? And both are normal and fine. And no reason to have surgery or anything like that, ladies. They're all beautiful. And it's also, like I said, very normal for one of them to protrude more than the other or be a different size or shape. This is the clitoral hood up here. Some women have practically none, and you just can't see it, and the clitoris is bold and at attention. And some women have lots and lots of flowery clitoral hood that kind of blends into the lips here and makes it difficult to even see where the clit is, but rest assured, she is right under the hood, just the same as if the hood were not there. So again, all perfectly normal. Nothing, is better than the other, or more pleasurable, or more pretty. It's all part of the great variety. If all of our faces were the same, the world would be so boring. And it's the same case for our genitals. If all of our genitals were the same, the world would be so boring. So thank goodness they're not. As I mentioned earlier, the clitoris is found under the clitoral hood. Some women with lots of tissue and skin here might not be able to pull it back in order to see the hood. Some women, or to see the clit. Some women can. Some women can't. Other women, the hood is smaller, and it's very, very easy to see where the clitoris is. It's this bump right here that's very sensitive, especially when she's turned on and things are wet. And this is kind of the orgasm spot for women, right? A little bit lower is the urethra. That's where women pee out of. Men pee out of their urethras too, but their urethra does double duty. For women, only urine happens in the urethra. We have sexual intercourse and babies, if we so choose to have them, from the vagina, which is a little bit lower and a larger opening. The urethra is too small to ever put a finger or anything inside, unless you go to the doctor and they have a tiny thing for urethra, but day-to-day things, much too small for that. And then the vagina is larger, and it's what we associate with penetration and things like that. If you kept on going south and around, you would find the anus, but Venus doesn't have that, so we're out of luck there. All right, so this is the main area of the vulva. Now, the spot that most people think about with pleasure tends to be the vagina, right here, that kind of insertable area. If we spread her open a little bit, you can see it right there. This is where penetration happens during intercourse or fingering or toys or whatever you're enjoying. And it is not generally what gives women orgasms. Yes, there are some women who are anatomically built so that they can more readily have orgasms from penetration. There's nothing superior about them. It's just a change in build that makes it a little easier. And they're the vast minority of women. Most women do not have orgasms that way, although you can have pleasure that way for sure. If things are going well and you're turned on and wet and you have a good mindful partner who knows a bit about what they're doing and you can communicate what you like, then it can be still very enjoyable. But what generally gives women the orgasm during intercourse is a hand that reaches up and some fingers touching the clitoris nice and wet up here. So, the first pleasure spot I want to talk about is the clitoris. Like I said, this is the orgasm spot. Now, it can change a little bit during sex and stimulation. For a lot of women, when they're getting really turned on and getting close, it might seem to like retract. You know, it might be very hard and proud when she's getting turned on, and then all of a sudden it kind of seems to disappear. Don't fear, it's in the same place. Just, you know, keep rubbing as she likes it or as you like it in the same area. And this is where the orgasm is going to come from. So that's spot number one to pay attention to. Now, when it comes to the vagina, we're looking at a few different areas that can be pleasurable that we can pay attention to. First of all, just to let y'all know, there's always the huge debate about whether size matters, and there's no one universal answer. For some women it does, and for some women it doesn't. And when I say it matters, yes, guys can be too large, and yes, you know, for some folks, guys can be too small. So, you know, everybody has their preference of what sizes they prefer for what different activities, so there's no universal answer. However, you would be pleased to know most likely that the opening of the vagina is the most sensitive part, and that's where a lot of the nerves are, right just in the entrance right here, not very far in at all. So, you know, regardless, that is a great place to do a lot of stimulation, especially if you can touch the clitoris at the same time. Both spots like that. There you go. The next place, going just a little farther inside, is the G-spot. It's about a knuckle and a half inside and responds best for most women. Explore and have fun to find out what she or you like to a come hither motion when she's really turned on. She's not turned on enough, that'll just make her feel like she has to pee. So pressure against that is the next spot to explore. So if the clitoris is too sensitive or just not waking up for you that day, you might try a little G-spot stimulation once you're getting turned on from lots of foreplay and fantasy and good stuff. Some women like it even just a little deeper, the cervix, which is the kind of the gateway to the uterus. The cervix is very tiny and nothing can get pushed inside of it or lost inside of it. The opening is so small. So you can rub it, and some women will hate that feeling, and some women, when they're aroused, will absolutely adore that feeling. Researchers have even done studies where women stimulated themselves to orgasm by using a device that stimulated only the cervix. And some of the women were so upset that they couldn't find a toy like that in the stores that they tried to take the ones from the research lab. True stories. Anyway, cervix will be good for some women and not others, and that's a spot that will really vary depending on where she is in her cycle, pre-post children, pre-post menopause, things like that. The last place I want to bring up to you inside the vagina is way, way deep inside, as far in as you can get, is sometimes called the A spot. And we get a few more nerves there again. So we have the entrance, the G spot, and the cervix, which are fairly close to each other, and then deep in farther is the A spot, especially when she's very aroused and her vagina is most elongated and things like that. So for some women who like really deep penetration, you know, whether all the time or some of the time, ladies, you have a particularly sensitive A spot back there. Other women just don't really get much out of that, and that's fine too. So those are all the different areas of the vagina to explore. And I also want to remind you that these labia here can be really sensitive and wonderful to stimulate and explore as well. So no need to skip over those. Remember to use a good lube for yourself if you're having different levels of stimulation or places that you like at different times. You may also like different consistencies of lubricant or different amounts. You can get really thin and watery lubricants, really thick or creamy gel type lubricants, and anything in between. So having a few varieties around, maybe getting some sample packets or something like that, can be very useful as well. All right, so there is a brief tour of the different areas of your vulva and your vagina that you can enjoy to see which you like best at different times of the month. You might even put it on your calendar if you're a researcher at heart, and to remember those differences in lubrication as well. I'm Dr. Ruthie. You can always drop me a line and check me out over at exploringintimacy.com. I would love to hear from you, and I will see you at the next video through Funwares. Thanks.